And you also won several teaching awards. One of them was the Gold Humanism Honor Society it was actually the Humanism in Medicine Award.
Yes, sir. Yeah. So, teaching, as I said, was something that I had really heavily emphasized in college. I was actually the lead tutor for a 40-person tutoring center at Penn State University, where I went to college. And so teaching has always really been a passion of mine. Excuse me. So teaching has always really been a passion of mine. And so I'd actually won several teaching awards just by doing what I do on TikTok and now on Instagram, which is, trying to be straightforward and not beat around the bush. I always kind of say that, medicine is a discussion, not a dictation, or that it's education, not dictation. And so my basic idea there is that patients now have autonomy. My medical school heavily emphasized medical ethics, which is really new in medicine to emphasize ethics. There's kind of this older philosophy in medicine that patients and doctors essentially should be paternalistic, which, is a very outdated philosophy that practitioners should be parental in nature, should be talking down to their patients and doing what's best for them, and that they shouldn't necessarily or don't have the capability to make their own decisions. And of course, medical ethics now tells us that patients have autonomy, which means that they, have the right to make their own decisions. But of course, in order to do that, they need to be informed. And that's what informed consent is all about. Us educating you so that you can make informed decisions about your own health care. And so, I take that philosophy and as I approach medicine, I had done that with students. And as a result, they had nominated me for teaching awards at their medical schools. And I had won those awards, both through my residency program as well as through their medical school. But they had also nominated me through their medical school for the Gold Humanism Award after they saw my interaction with patients. And again, this award essentially emphasizes or honors practitioners who practice humanism in medicine, treating the patient like a human, as opposed to, again, kind of dictating how the care should be.
And did you actually, is this award with other physicians, do you get nominated for it, or is it you get selected among your peers that you work with?
Yeah, it's a little bit of both. So it's not something that I applied for or even knew that I was a candidate for, which is true as well for the teaching awards. I got nominated by the medical students who saw me interact with my patients. And then subsequently, other people were nominated, and I, again, subsequently won the award over other people as, each class. So medical school has 4 years, and the third or fourth year class in that medical school had nominated me, and I, won compared to other people that had also been nominated.
And talking more about informed consent, I think that's quite interesting because not many physicians talk about that. There was a video that struck me, I think you did a reaction to on TikTok. It was another doctor, physician, MD, who put a video out saying that doctors aren't there to solve your problem, but they're there to actually guide you. Your health is actually in your own hands as a patient. They can just give you the treatment options, but you make a decision at the end, and you're responsible for your health. I think the title was, "We're not responsible for your health, you are."
Yeah, I'm actually not sure. That's not exactly my philosophy, and I'm not sure that is actually one of my videos, because I actually agree with the other doctor that,
Not one of your videos.
Yeah,
it was
sorry
someone
about
else's
that.
video. I think you did a stitch to.
Oh, okay. Yeah. I mean, I don't recall that video in specific, but I agree that, patients are responsible for their own health, but I don't mean it in the way that we shouldn't take responsibility as physicians. And again, I don't recall the specific video, but really, again, my philosophy is that our role as physicians is to be a guide, to be a teacher. So when people come into the office, I see my role as an educator and a communicator. And that's actually what I call myself. If anyone has ever seen the Discovery Channel or the Science Channel, there are people like Michio Kaku and Neil deGrasse Tyson who basically are world-renowned physicists who try to break that information down in a way that people can understand to help people not only understand science, but get interested in STEM and science. And I see my role as doing that in the medical world. I want to take difficult and complicated medical concepts and break them down in such a way that patients can then use that information to educate and advocate for their own healthcare, because not every practitioner gives patients choices, and not every practitioner treats the patient as an autonomous human being, as someone who can make an educated and informed decision based on their own healthcare and their own knowledge of their own bodies and health. So that is always my philosophy, is that, again, medicine is a discussion and not a dictation, and that we are here as educators to help you learn more about yourself and make decisions about yourself that will align with your views on life, not necessarily what I think is best for you.